Gravi Health, the pregnancy support.
Hello there. Today we will discuss an interesting topic: birth preparedness and complication readiness in pregnancy. We will explain to you what it essentially means to be prepared for your birth and ready in case any complication arises or if things do not go according to plan. We will share a survey which you can use to assess your preparedness. But first, we will start with a scenario for you to have a better understanding. Adaku is a 32-year-old in her 37th week of pregnancy. She had registered for antenatal at a hospital far away, but on the day labor came, there was fuel shortage in the country and she could not get any vehicle to carry her to the hospital. Fortunately, the nearby health center was a stone throw from her house, and that was the place she was delivered of her first baby. Every mother wants to go into labor and come out with their baby alive. Pregnancy is like a journey, and like every journey, there is need for adequate preparation, which is known as birth preparedness. Taking proactive steps in case complications happen is known as complication readiness. Complications that can arise include obstructed labor, sepsis, hemorrhage, preeclampsia, and other life-threatening conditions. To prevent against these occurrences, there is a need to be prepared for birth and any complication. Birth preparedness and complication readiness helps pregnant women identify skilled birth attendants, identify signs of labor, and to recognize danger signs for pregnancy-related complications. It also helps to reduce other barriers to seeking care, such as transport costs, perceptions of poor quality of care, and cultural differences. Preparing for childbirth and associated complications reduces the 3 delays of maternal death, which are delay in recognizing danger signs, delay in reaching health facility, and delay in receiving health care. Pregnant women, their families, and communities are encouraged to effectively plan for births and prepare for emergencies if they occur. The components of birth preparedness and complication readiness are majorly divided into 3. First, psychological component. This involves preparing your mind for labor and making adequate plans for the success of the pregnancy. It also involves you cooperating with your doctors and midwives as well. Second, physical component. This involves the tangible things you can see and touch, such as baby materials, birthing kits, blood in the blood bank. Third, financial component. This involves having the capacity to pay your bills and make purchases that are needed for your care, including drugs, delivery fee, and sundries. We will go further to discuss each item in the birth preparedness and complication readiness in pregnancy list. Arrangement for transportation. Pregnant women are encouraged to register for antenatal at a center close to their homes. This is for accessibility in case of labor and/or an emergency. Even though you prefer a further place, there is need for plan B in case the roads are blocked, if you have a flat tire, road closure due to road work or maintenance, or even fuel scarcity. You must be able to confidently answer the following questions. Who will be responsible for moving you to the hospital, and what vehicle will be used? Is the person reliable? Is the person available at all times? Is the person's number address easily reachable? Saving money for delivery. Delivery and childbirth requires skilled manpower, and you are required to pay for the services they render. Budgeting and saving money is very wise so as to obtain the best care for yourself and your baby. Even if your care is free, you must have some money to pay for some of the services the government program doesn't cater for. Start saving money today. Identify skilled midwife or doctor. You must make sure that the center you are registering for antenatal has a skilled midwife or doctor so as to have the best outcome. Some centers do not have facilities for cesarean section, but can promptly refer you to a center with facilities. You must do your due diligence. Identifying place of delivery. This has been overflogged. No woman is encouraged to birth at home irrespective of cultural or religious beliefs. Most places require you to book for antenatal care so they can monitor your care and plan for your delivery. So identify a place that is close to your home, has good review by previous customers or clients, clean and conducive environment, and offers professional services. Identifying blood donor in case of emergencies. Bleeding is a common complication from labor and may require blood transfusion to replace the loss. Sometimes, a patient may end up in theater and may need to be transfused. Thus, you must identify a blood donor who is compatible with your blood type and always available. Some people assume that they can always buy blood, but in certain conditions, blood may not be available in the bank, and this may cost the life of the mother. For those whose religion or culture does not allow blood transfusion, discuss with your care provider for alternative options, as some facilities do not have the skills to cater for you in case of blood loss. Awareness on danger signs. Every pregnant woman must know all the danger signs and must be taken to the hospital if any of them occur. Danger signs include bleeding from the vagina, convulsions or fits, severe headaches with blurred vision, fever and/or too weak to get out of bed, severe abdominal pain, fast or difficult breathing, and sudden gush of water. In conclusion, pregnancy is like a journey to your lovely home. For you to get there safely and happily, it takes preparation. Are you prepared? Download our birth preparedness and complication readiness checklist and see how prepared you are. Thank you.
For more antenatal videos, tips, tools, and professional help, kindly visit our website at www.gravihealth.com or visit our social media handles on Instagram, Facebook, Twitter, and YouTube at GraviHealth. GraviHealth, your pregnancy support.